This video is on why you should dissolve some ugly work, okay? And this came up about 2 or 3 weeks ago, and I've been wanting to shoot this video but haven't had time to do it. What I'm talking about is a lot of people do juvederm, restylane, hyaluronic acid, which is what I do for a living, and they say, you know what, I have this ugly, deformed, crazy-looking lip, and I'm just going to live with it, and it will eventually go away, right, Doc? Just yesterday, I did a lady who had, I said, please let me dissolve your lip. It doesn't look natural. I didn't do the lip, but she had it done 7 years ago. So I'm going to tell you, how long do you want to wait until your face looks natural? My suggestion is something looks swollen, weird, big cheeks, big lips, ugly work done somewhere else. Let me just fix it. Let me just dissolve it. Let me get rid of it. Why should you live one more day looking fake? Now, I'm going to tell you, a lot of people say, Dr. Lamb, I'm tired. I don't like people that look fake. And they walk into my office and they look fake. And why is it the reason why you can look at someone else and say that person looks absolutely fake, but I look fine? And the reason is that you're looking at very obvious results that look fake. And you may not notice the fact that you have slight areas that don't look right, because this is all I do for a living. And a great example is my general contractor was walking with me through another home, and there were some things off with this home. I was looking at a prospective builder for my home, and this was off, this was off, this was off, and I didn't even notice any of them. But the reason for this is that's all he does for a living. He has a very high standard for construction. That's why I'm using him as an owner's advocate to help build a home. Same thing for you is that you may not notice things are fake, but I have a very, very high standard of what is fake and what is not fake, and I want to help you. So my point of this video is, if you've got something that doesn't look right, instead of waiting, now if it's a week ago, now that's different. That could be some swelling. If it's 2 weeks ago, it could be some swelling, especially if you're one of my patients. But if you're like 4 months out, 3 months out, 6 months out, 1 year out, 2 years out, don't wait for that unnatural result to dissipate. Just get rid of it. I had one gentleman that with these big bags under his eyes. I said, what is that? He says, I don't know. I've been having it for like 3 or 4 years. I said, did you have fillers done? He goes, yeah, I had some fillers done in Chicago a few years ago. And I said, let's get rid of it. He goes, he said, you can get rid of this? I said, yes. So I dissolved it, and then within 3 hours of a day, it was already normal, and he was like in tears. He said, I can't believe no one told me I could do this. I just had an email for a lady from Miami who had some fillers done, a referral from one of my patients with some juvederm that's been still sitting there as a bump at a year. She went to go see some Miami doctors, and they told her she has to surgically cut it out. Now, I do more surgical lip excision and corrections probably than most people in the world. I do one about every other day, and all she needs is a simple dental block and a little dissolve in 2 seconds. I'm like, what the heck? Let's dissolve this thing. She doesn't have to fly to me to do it. It's something that anyone could do. But to hear some doctors saying, look, the juvederm, okay, that was done 2 years ago, you must need surgery, is insane, okay? The products that I do last. They can last years. Don't wait to dissolve it. I know this is an extremely long video to say the same thing over and over again, but sometimes I want to beat you over the head and tell you, get rid of the bad products. If something looks fake, come in and dissolve it.